Hello, I'm Dr. Laukin, and thanks for joining me as I talk about radiation treatment in relation to breast cancer. And this video is for people who have BRCA1 or the BRCA1 gene variant. And suppose you have BRCA1 and have developed breast cancer. Uh, you typically will have a team involving surgery, potentially medical oncology, radiation oncology, and supportive care. And all components of the team working with you have as their foremost goal your well-being. And one of the things that comes up as a key decision point is how best to manage the breast areas themselves. And there are basically two alternate pathways. One pathway, which is the most common choice, is to have a bilateral mastectomy, and that may be accompanied with a reconstruction. And the other choice is to one of preserving the breast for the breast with the cancer, if it's a single breast, to do some form of local excision or lumpectomy, and then add radiation to the involved breast. And then to carry on with surveillance of both breasts and intervening if and when there's another event in the breast, which could happen. So we have the common choice and the alternative choice, and I'm going to talk more about each of those. So first of all, why think about removing as much breast tissue as possible? That is the bilateral mastectomies. Because a bilateral mastectomy will remove almost all, but importantly, not all potential breast tissue. The reason is straightforward. The remaining breast tissue after cancer removal will be vulnerable to cancer development over the course of time. If that tissues in the pathologist's jar, it's obviously not going to cause another cancer. Well, why think about breast conservation surgery? Well, a key point there is that if a person's goal is to either avoid or to delay as much as possible the major step of removing both breasts, it makes sense to at least look at this. And so, what do recent studies tell us about those choices? What do they say about the outcomes with a breast conservation approach? And what is available to guide us in comparing the two? So I'm going to talk about one study first that was published in 2024. And it looked at a cohort or a group of patients that were followed over the course of time at a famous institution, the MD Anderson Hospital. And this group of patients was gathered as people who had uh, the BRCA1 or BRCA2 and who chose breast conservation rather than having the mastectomy as their principal treatment. And there were about 170 patients, and about half and half BRCA1 and BRCA2. So about 90 patients were BRCA1. Now, the vast majority of people that had the breast conservation also had breast radiation. So it was sort of a package, uh, local surgical management and radiation treatment to the breast. And what kind of outcomes were seen at an overall 10-year follow-up? Well, taking all the patients, some of who would have more aggressive and some of who would have less aggressive cancers, the overall survival was about 90%. What about the occurrence of cancer in the breasts, both the initially involved breast, the same side, and in the other breast? Well, the risk of another breast cancer event on the same side was about 12%, and the risk of a cancer event on the other side over that 10-year period was about 20%. Just look at that again, just in pictures. We look at the left at the same side. The person had about a 1 in 8 chance of having another breast cancer event after having the abnormality removed and typically radiation. And on the other breast, about a 1 in 5 chance of developing a cancer. Looking at the person's initial goal of breast preservation, what was the rate at 10 years of being bilateral mastectomy free? And it was about 70%. Now, what about estimates that extend to a longer time, not to 10 years, but 20 or more years? If we look at the opposite side, estimates both by the authors of this paper and by others are just under half of people will have, in a 20 plus year period, cancer developing in the opposite breast. As far as the same side is concerned, maybe it could be as much as 30% as 20 years, although there are some studies that report lower percentages, especially if the time is less. So the conclusions then were that for women with BRCA1 or BRCA2 who choose breast conservation, they do have a higher than average chance of having another cancer event in the preserved breast, and it's about 1 in 8 at 10 years. If we were to compare that to people without the BRCA gene issue, the numbers would be more like, say, 1 in 20 or a little less than that. And they have a higher than average chance of another cancer event in the other breast, which would be about 1 in 5 at 10 years. But another way to look at that information is to say, gosh, most of the people, in fact, were able to retain the breast. 70% were bilateral mastectomy free at 10 years. And so the ultimate conclusion is that it's not unreasonable to look at uh, breast preservation if the value of retaining the breast is seen as an important one in terms of the patient's overall wishes. And this just shows the source of that information published in June of 2024 in the JAMA Open Network. And the verbatim conclusions as published, women with breast cancer and BRCA1 or 2 treated with breast conserving therapy had above average risks of same side and opposite side breast cancer events. Most didn't have another cancer event, and most remained bilateral mastectomy free. So now we're going to look at something different. The outcomes of bilateral mastectomy compared with the outcomes from breast conservation. We've seen already that breast conservation is associated with a higher risk of local recurrence in the treated breast. And if the other breast is preserved, obviously cancers can occur there more often if the breast is removed. But let's look at the key thing of being alive. And it turns out that survival outcomes are about the same. And when we say about the same, like, why aren't they exactly the same? It's because it's hard to accumulate data that enables one to make an exact apples to apples, oranges to oranges comparison. But let's look at that conclusion. How do we determine that the survival outcomes are about the same? Well, there are a number of publications that say let's combine many studies that compare groups of people that have the BRCA1 or 2, that have breast conservation, or that have the mastectomy approach. And this method of combining studies is called the meta-analysis. And there's one in particular that was published in the fairly recent past that accumulated nearly 4,000 cases of BRCA1 and 2, of which about 2,200 were the BRCA1s. And their conclusion was that the risk of mortality or death was equivalent for breast conservation and the mastectomy groups, even though the local recurrence rates for the conservation were higher. The idea is that that one could salvage those recurrences, that they didn't necessarily lead to a fatal outcome. And in this large series, the vast majority of the breast conservation cases had radiation. And this, in fact, is the source document published in 2021. The title, Combined Breast Conservation Therapy versus Mastectomy for BRCA Mutation Carriers, a systematic review and, they say, the meta-analysis. And the conclusion is published: survival outcomes after breast conservation therapy is comparable to mastectomy in BRCA carriers, but the risk of local regional recurrence is increased, and that patient counseling should take that in mind. So how do you decide? Well, the most important thing is your own risk preferences. What do you feel most comfortable with? And some people will say, gosh, I want to have all that breast tissue gone as soon as possible. I don't want to have surveillance. I know that removing all the breast tissue doesn't guarantee that I won't have a breast cancer event. I mean, that's not possible, but that will reduce the risk. And I think I can get through the surgery, and I feel confident if I'm going to have a reconstruction that I'll have a body image satisfaction and so on. And others might say, well, uh, if I can retain my native breast tissue in as close to a normal form as possible, that maintenance of body image at this time in my life is important. I might want to breastfeed, for example. I for any variety of personal reasons, I would really like to preserve the breast at least for some period of time. And I'm okay with the idea of having surveillance examinations, mammograms, MRIs, and so on. I can handle that. And I don't mind living with that element of uncertainty, because I feel that there would be a benefit from the breast preservation. I really don't feel that I'm up to really more substantial surgery right at this moment in my life. And I think the key takeaway from the papers that I've discussed is that if we look at, the big objective of being alive, that both of those choices give you the same chance of being alive. Uh, so I hope that this is of some use as you contemplate your choices with your medical team. Thanks for your attention and interest.